COPD, chronic obstructive pulmonary disease, refers to a progressive group of lung diseases that make it difficult to breathe. It causes long-term blockage of airflow and reduces the lungs' capacity to move air effectively. Symptoms usually develop slowly. Breathlessness during routine activities, a persistent cough, and mucus production are the earliest signs. Over time, breathlessness increases and daily tasks become harder to manage. COPD includes two major forms. Chronic bronchitis brings continuous inflammation of the airways, causing long lasting cough and sputum for months each year. Emphysema damages the tiny air sacs in the lungs, leading to severe shortness of breath, especially during physical effort. Long term inhalation of cigarette smoke or polluted air triggers inflammation inside the airways. Sometimes genetics like alpha 1 antitrypsin deficiency trigger early COPD even in non smokers. Over time, the swelling narrows the bronchial tubes and destroys the terminal air sacs, reducing the lungs' ability to move oxygen and carbon dioxide. The damage is permanent and continues to progress if exposure continues. Medical help is essential if cough and sputum persist for months. Breathlessness interferes with routine activities or infections become frequent. Early diagnosis can slow deterioration and prevent life threatening respiratory failure. Smoking is the strongest risk factor for COPD. Increasing age, long term exposure to irritants, and a history of repeated respiratory infections also raise the likelihood of developing the disease. Doctors confirm COPD through spirometry, chest scans, and blood tests. Spirometry reveals how much air the lungs can push out, crucial in detecting early obstruction. Treatment aims to ease symptoms and improve breathing. Bronchodilators open airways, inhaled steroids ease swelling, antibiotics fight infections, pulmonary rehabilitation rebuilds stamina, while oxygen therapy supports advanced cases. With the right treatment, many patients reclaim their routine and independence. Living with COPD requires a steady routine. Staying active, breathing exercises, avoiding infections, and regular medical follow ups. These steps help maintain lung capacity and quality of life. COPD can be prevented by staying away from smoking and limiting long term exposure to substances that irritate the lungs. Staying indoors or wearing an N95 mask outdoors during high smog hours using air purifiers can significantly reduce risk. Because the simplest choices today can save every breath tomorrow. Harshita Obroi's report for Wellness Watch, DD India.